Din, nakamute ka po.
I thank you very much for reminding. Okay, so we will have. So last week we had the discussion on the nursing informatics, and we have so we have people, processes, and technologies. And considering the people is considered as the end user, the examples that we have set on the processes are those the processes wherein the people when the patient will be admitted to the hospital, how the hospital will process his information, and at the same time yung protection of the patient's profile. So that concerns with processes. The technologies that we are talking about here is the use of the platform. So we have various platforms. The platform itself is the one that will be used to implement those processes that I have mentioned. And who will be the one who will benefit from processes and technology for efficiency? The people, who's the end user. And when it comes to application of this, the data, okay, so we have the data which could be observed by observation or terms, and it will be converted into relevant, useful, and meaningful. If we say relevant, this is more considered as and meaningful if this will align with the objectives and goals of the organization. So since we have discussed now the three fundamental components of the nursing informatics, just the same as are similar with the first slide that I have shown. So here the end user that we are informatics as well. So the healthcare processes wherein these are the procedures where the nurses will be involved. So usually electronic clients up to the discharge of the client, record all the and document the care management that you have performed and procedures that you have performed. You retrieve on how you stored the data into useful information, retrieve those information that will be useful for holistic approach and care management for the client. So the information technologies referring to the platform, which I have mentioned, is the hospital information system, which will apply the patient care into clinical data. So thus, it will be converted into relevant, useful, and meaningful, meaning it's meeting the. We have discussed also so in the nursing informatics, according to American Nurses Association, it embodies the three concepts. So we have discussed the nursing science as the application of, kasi we have discussed defined accordingly, science that we do in application of technology is a procedure or a step. If we consider nursing science, so we are considering the application of the principles and concepts of nursing in a systematic way using technology. When we use information science naman, the information on how to process information. If we have analytical science, this is a systematic way on how useful, meaningful, and relevant way. So analysis. So we have identified that using the three concepts of the nursing informatics, consider on identify, define, manage, and communicate. Communicate is a way on how you will coordinate with the healthy members. So through the use, the nurse can communicate to any of the healthy members using the platform in a hospital setting. Even in a community setting, the nurse, the city health office, and to other agencies through the use of the platform. If we consider manage, this is on how the nurse will maximize the use of the three concepts of nursing science, will manage accordingly through the use of resources to achieve the nursing practice utilizing data information knowledge. The three concepts of the nursing informatics as defined is to give us a clear meaning, okay? A clear meaning of what we are, gives us the purpose. So for example, why do we need, it answers the why say when we define, it gives us a clear meaning. Why do we need to store the patient's profile in the electronic? So it gives us a clear definition of the meaning of what we are doing. If we are considering identify using the three concepts of nursing informatics by American Nurses Association, definitely consider po how the nurse will use it for decision making and the data viewing what we have discussed last time. And considering that the concepts of the nursing is relevant to decision making. Okay, so the stakeholder, the big concepts in the decision making are nurses, patients, interdisciplinary team, ibig sabihin, the healthy members, consumers, those who are recipients of care as outpatient or others who attends to the services of the hospital. So if we are considering the decision making areas are very important: structures, processes, technology, and information. In decision making, we can consider structures because the structure itself gives us the coordination or the process itself. It gives us the picture of a systematic way on how to handle information. Technology is used on decision making. So if we have the platform and technology, if the nurse and the doctors may have an access on it, we could be efficient in the care management of the client if we will retrieve the patient history. The very relevant and very important item, which is the information when it comes to decision making, through the use of the structures, processes, and technology. So we have discussed also that the nursing informatics is a nursing specialty. Here in the Philippines, nursing informatics, but informatics is a nursing specialty, which was established by American Nurses Association in 1992. And it is the Philippines, we are having our nursing practice. Our scope and standards of practice are covered by our law, which is the Republic Act 9173. So here in the Philippines, we still don't have the certificate concern. So we have discussed also the role of the nursing informatics specialist. We have considered here the roles of clinical information and systems implementation, on how the nurse participates when it comes to the basic information such as medical history, patient diagnostic exams that have been done with the results. So those are the clinical information and systems implementation of a nursing informatics, or the informatics this we are considering. We have considered rather the okay, how to sustain the operation of the hospital using the platform. So education and training, we have considered here on how the nurses will, how the informatics nurse will mentor the other nurses, most especially those competencies on how to become an informatics nurse. So when it comes to data analysis and reporting, this refers on how the data has been consolidated, and this could be useful for comparison, for monthly reports. So this is how the data and information will be generated. In terms of the oversight, may have an oversight role on how the platform itself of the organization is being used by all departments, since it will benefit all the departments, not just only nurses. So that's why one of the role also of informatics nurses collaboration and leadership, because the power of being an informatics nurse is basically the skills that he may have. He's a trained and he specialized on it. So collaboration and leadership is very important so that for the others to become efficient also of what they are doing. So we have also mentioned, actually we have discussed this already, and this will be your assignment. It has been posted in the MCUBLE, which will not be submitted today. It will be submitted on the other scheduled days. So we have mentioned the nursing informatics competencies. Why nursing informatics are now as part of the specialty of nurses? Why is the significance and trends? We need to, when the time of 90s comes na and introduces the use of the computers, it gives us the benefit when it comes to the storage of data and processing of information. So these are the three that have been considered as the issues and trends to answer why nursing informatics competencies are relevant in the practice of nursing. So we have included here advancement international. It's locally, universally, and worldwide accepted, because almost the setup of the hospitals, clinics are geared towards the use of technology. Significant of impact to nursing, because we all know that nurses are the ones who are having the largest number of workforce locally, national, and globally. So embracing the technology is very relevant so that we could be part of the changes and the paradigm shift. Actually, class, EHR means electronic health records. When it comes to electronic health records, most of the hospital, actually all of the hospitals are already using. It is not written, but basically it could be accessed through the use of technology and the computers as well. So other gadgets may be also used now as part of the advancement. So these are the significant trends and issues. So what are expected for you to connect, for you to solve, and to meet the expected competencies of nurse informatics? So basic computer competencies, I know for a fact that your generation are very advanced when it comes to the computers, the gadgets, application, platforms, even not just only computer application, desktop applications, but also mobile applications. Your generation can invent, can design rather, can design an application which could be useful. So information literacy is related on how you will process information when it comes to basic storage, retrieval, protection. Yeah, this is more on the information literacy. So information management is this is on how you must be knowledgeable when it comes to protection, just like here in the Philippines on the Data Privacy Act. So this will be part of your assignment. What you will do in your assignment is you will choose one trend, think of the competencies which best fit of what you have chosen from the issues and trends. Then you will explain. Okay, so that I may evaluate what would be in your mind if you really understand why nursing. So those are the topics that we have discussed last time. Now, to the concept of nursing informatics, there are three areas. We have mentioned nursing science, information science. Actually, the other one is analytical science. So we have considered computer science. Actually, when we talk about the nursing science, this is wherein from the term it's on how you will handle information. That's why even during your experiment activities or laboratory activities, for you to discover things, for you to analyze things. So you gather the data, you analyze the data, then you have the conclusion. So it's a step by step. You cannot arrive with any conclusion at all before without the gathering of the specific data. So the science, if it is merged with the use of the principles and applications of nursing, so in everything we do, we are aware of that. We do it in step-by-step procedure. So just like in nursing informatics, before we process information, we gather data and we convert it into useful information. So next is information science. Information science is from the term itself, a systematic way on how you will process information. Okay? This is usually associated with investigation, ha. Kasi when we talk about investigates, that this conforms of what science is. The investigation is a process, is a systematic process. Okay? When we talk about information, then a systematic, or you investigate or you use this information that will be how will it be accessible and how it will be useful. That's why in the first few slides that I have addressed, the role of the nurse as part of end user, or the people as end user, is to apply this data to be useful, meaningful, and relevant. So how you will process this is through the information science. So the word itself, investigate. So next is, uh, when it comes to the information science, it also address the body of knowledge. So that's why science. When it comes to the collection, organization, storage, so these are the process. Once you store, you organize, you collect, you interpret, you transmit, you share, you utilize the information, that is what we call information science. So one of the example that you may have here is when a nurse collect data during the patient history, she use a platform or an application that is stored in a tablet, okay, in a tablet or in a gadget. So at the time that the nurse entered the pertinent data about the patient, from the demographic profile up to the findings of the physical examination findings, and up to the other results of physical examination findings, then you organize specifically this data to, if this data could be what? If this data could be used as patient history, medical history, previous hospitalization. So when it comes to the storage itself is to where it could be stored and for how many years it could be stored, because there are some institutional guidelines that will the storage of information could be lifetime. For PSA, it could be lifetime. But for the hospital, will it be lifetime? Kasi try to imagine why we do the paradigm shift to this nursing informatics. It's because if the hospital, for example, just like MCU Hospital, was established in 1947, and considering all patients from 1947 up to the 2021, can you imagine the medical records that full of folders and papers and that have been used before may cause the possibility of destroying it or damaging. The registrar's office are doing the digitalization of your records so that it could be stored in a way that it could be protected. So what kasi the problem is the integrity of the records, if it passed through the years, this may cause its damage due to the years and the time and the period. So this is information science. Now, when it comes to the computer science, this is actually the use now of the information has been processed. So that is information science. If we will use now the technology wherein, for example, we will use code, wherein nurses are the only ones who can interpret it. If we will use the actually, when we talk about computer science, it's all about representation, eh. For example, if the nurse will process the information and the data itself, the nurse who may have the access right on that computer will be the only one who can interpret those stored data. So on the perspective, for example, that an admission officer who is not a nurse and from a nurse, they may have different knowledge and skills. So in computer science, it may depend on how the healthcare practitioner or how the individual of the institution will use these algorithms. If we use algorithms, these are on how we will process accordingly to interpret on his own the specific codes that will be used. And that is through the use of the institutional policies on how to process information. So now, if we talk now about nursing informatics, it integrates the three areas: nursing science, computer science, or analytical science, and the information science, which is used to communicate data, information, knowledge, and wisdom. So we are four. In our previous discussion, we do only have data, knowledge, and information. Information and knowledge. But the wisdom is, if this knowledge is utilized now and reach the community, reach the whole organization, it becomes wisdom. Okay, if it could be applicable to all. So that is one of the topic on the nursing informatic pertaining to the theory of theories and healthcare and how this applies in informatics. So let me share my screen again for this topic. Do you have any question on the discussed topics on the nursing informatics? Are you still with me, students?
Wala.
Do you have any questions on the informatics and theory? Thank you so much. Okay, so I will just have this shared. Mhm. it's not shown in the screen. So for a while, so we still have how many minutes to continue you with the next topic, free and health informatics. So this is how we will before we consider the whole primarily on health informatics, then it becomes nursing. So next, okay, just for a while. Art, theory and health informatics. So thoughts that represent reality. That's why in your first year topics are considered theory. So the collection of thoughts and how we could consider to represent the reality. It is on how it will give us the idea. It answers actually the why. Why the specialization and special. So the collection of thoughts answered through the we consider the expected competencies of nurses in nursing informatics. It's because it answered because of the advancement in the technology. Second, largest manpower or workforce globally. Thirdly, applications now and technology where hospitals and most of the healthcare institutions have adopted. So what would be the challenge? The challenge must be trained and must be confident in the performance of her role. And one of the role is technology. Answer how nurses will perform her role accordingly from a basic concept. Actually, it's a lens. It is a lens through which the worldwide accept. So for example, if we implement hospital information system in the Philippines, there could be hospital information system in other countries and in other setup. They have adopted it, the review, that this could be helpful not just only in the national level but also in the global level. But the idea on how to answer questions and the whys. So informatics theory or theories are significant when it comes to communication, change, systems, and information. Informatics theory will give us the idea on how it will use. Like in our present situation, a doctor may not have her rounds to the hospital with the physician. The physician can depend on the nurse's physical examination findings so that the doctor may possibly change may prescribe a diagnostic examination, or probably the doctor will subject the client for discharge. So that convenience gives us the idea that this theory will give us the because for communication and coordination. However, the challenge for nurses, theories in informatics is nurses must be competent in doing it because any error and referred findings of the nurse since for assessment. So higher expectation is also considered. So the doctor is expecting too much to nurses who are competent in doing physical examinations. Will be gathered through the nurses who are attending the patient and those in the information system. Theory also consider the shift on how the nurse will adapt and this change for purposes of being efficient and sooner to meet the outcomes of being effective. So the stance, remember, when the computers have been introduced to the workplace, who are most resistant? The most resistant are those with the old age because they have they may not have the interest anymore to be trained accordingly hospital. However, even nowadays, most of the older are engaged into Instagram, are engaged into other platforms, which they find it very beneficial. Even the Zoom platform, the most of the older population learned how to use it because this is how the people now communicate with of the limitations when it comes to physical and face-to-face gatherings. So these changes could be adapted and it is very stems. The systems is somehow related to number two change. Is gearing towards as a premier hospital. And if other hospitals are adopting hospital in a way of doing it, no, the challenge must be accepted of a systems change or a systems improvement so that to adapt specifically the objectives of the. Can you imagine that the other hospitals are to be competent on how to process electronic health records? Then there are many studies that shows that it really helped the hospital. And through these reviews, they will have this, for example, in our school, before manual enrollment of the AIMS portal, we can do the enrollment even at least that serves the convenience. But let us face it, there are still advantages and disadvantages of it that is being processed that are accessible. But nowadays, we have the Data Privacy Act for us to implement the protection. Now, the first theory that we're talking about is all about BLAM 1986, the clinical information system. So in the clinical evolution, if I'm not mistaken, yeah, pinanganak na ba kayo nito? So if you are 20 years old, so 86, parang hindi pa, no? Hindi pa kayo pinanganak na ba kayo nito? Des? Have you been born 1986? I'm not hearing any answers. So it means. So anyway, that's not our main concern. The main concern is I'm still older here. And anyway, in the clinical information system, it started. That's why I started my discussion about data information knowledge because it starts in 1980. Items that are made available, and once this data could be interpreted and valued, that knowledge, if the data in the information has been converted to set rules and have been utilized. Now, when it comes to the conceptual framework for the study of nursing informatics, according to Graves and Corcoran Perry in 1989, uh, to study nursing informatics, the concepts of data information knowledge, but it integrated already the management involved. That is why when it comes to data information and knowledge in 1989, this gives us the idea during that time that when you process data information and knowledge, it must be systematic. So that's why it must have plan, it must be organized, it must have the direction, and it must be evaluated. So that is what we call in the management. Again, in management, we have plan, it could be organized, it could be direct, and it must be evaluated. So in data, information, and knowledge. So that's the difference with the first one. The first theory that I presented in number 1 is just presenting to you the concepts of data, information, and knowledge. But here, the data, information, knowledge, it integrate the management process. Okay, the plan, organize, direct, and evaluate. Next, Nelson data to wisdom continuum. In Nelson's data still in 1989, it gives us now a clear picture on how data, information, knowledge, and wisdom is being utilized na. So if you will notice, in data, it is just on the level of collecting. Okay, collecting because it doesn't have any meaning at all pa. Okay? When it comes to information, it is now on the process of you can now interpret it because it gives you now the meaning. It gives us you are given already the definition of those terms. From data, you collected it, then you organize it accordingly, you cluster it, you can interpret it because as what I told you, data 89. When you put 89 kilograms down, it talks about a weight. Okay? So when we talk about patient, it gives us a clear information that the gender is female. So we add demographic profile. When we consider knowledge, we have now a higher level of interpreting, integrating, and understanding. So the understanding itself is how we will utilize the data and information to a higher level of usefulness. It may not only benefit the nurse, but it will benefit the whole organization. So if it becomes wisdom, it now considers the application will be a higher level than knowledge kasi the knowledge is probably you may be aware, you can do it may now apply of what you have learned. So this information can be now useful to benefit not just only yourself but also others and the organization as well. So that's why when we talk about wisdom, it becomes complex because this is a simple and becomes complex because the complexity of the wisdom is higher because it is expected that this could be more useful. When we talk about interactions and interrelationships, we could say na that's why it's a chain because data cannot be away from information. So it means that all data must come wisdom. So just like in our curriculum we have lecture, we have skills lab, and we have the RLE clinical. So for example, in the lecture, this could not be validated if you really acquired the necessary competencies. If you are and you can have a higher level of confidence if you can do it in an actual patient, just like our RLE clinical. So this is just the same concept of what we have considering in Nelson's data to wisdom continuum. So I think this could be the last time because it's almost 5. The fourth is informatics to improve health. So this is according to Bellinger. This is more complete on how it will be utilized because just like for the number 3, we have started with data, information, knowledge, and wisdom. But it turned out that it added practice and health community. So it means that when we start with data, information, knowledge, and wisdom, this could be individualized. But once it becomes wisdom, you are now sharing it with, when it is applied in the practice, majority of nurses, even outside your institution, will benefit from such. So this may also applies on how a research, kasi science yan how findings can be useful for the nurses and how could be useful for the community. If you will notice when it comes to the case presentation and case studies that you have, di ba you have significance of the study? You consider the significance of that study who will benefit the findings of your case study. So if you will consider this is a more complete I may end up to this because it's almost 5 o'clock. So it's almost 5 o'clock and hoping please refer now to your questions of the discussion will still be part of the prelim examination by next week. So I may the other slides that I may separate recording of it for your access. So this discussion will also be available in MC